In our state standards and competencies, we are to cover certain different occupations concerning healthcare for the medical therapeutics class. And in that, we decided to not only cover that, but to go beyond the scope and to cover what occupations are available in the whole hospital. They had to get a shoebox, and then they had to draw from a bowl a different unit of the hospital or department. And then from that, they had to create their unit. And then they had to give a presentation, an oral presentation, showing their unit and explaining all the things about it. Staffing, cost to operate, profit and loss for the hospital, clients served, all kinds of different aspects that they had to give a written report and a presentation on. And so they had to do a lot of work, way more than just putting together the unit. I just wanted him to meet the two that put it all together. And then every one of my students in here had an individual unit. And
very impressive.
Very impressive.
Therapies and nursing both are definitely in demand. Trying to think of some others. Well, lab techs, I mean, they're always in demand. Radiology techs kind of peak. They sometimes are in a lot of demand, and then other times there's an oversupply. So that's probably not quite as good an area where you can be pretty well knowing that there's going to be an opening. But really, a lot of the clinical areas, all of those are good areas to go into. Now, administration is a good area too, but there aren't going to be as many jobs there as there are in the clinical side. So, but healthcare in general is just a good field to go into. The other thing to think about beyond hospitals, kind of think of that whole continuum, is long-term care, nursing homes. Obviously, a lot of older people mean there's going to be more nursing homes, and nursing homes, they have some RNs, obviously, they have a lot of CNAs, certified nursing assistants, and so there's always going to be a big demand for CNAs, and that doesn't require as much education, obviously, past high school, but can provide a good income at the same time. Also, other things on that continuum, pharmacists. We've obviously started pharmacy school at East Tennessee State over the past few years. We put in a considerable amount of money into that program too, because we had a real shortage across the country, but particularly in Tennessee, in pharmacists. Now what's happened, there's been a number of new pharmacy schools started, like EPSU, that's helping fill a good part of that gap. But we still find ourselves today, I know at Johnson City Medical Center, we've got a couple of pharmacy positions open right now. We're kind of recruiting on a national basis to find pharmacists to keep in. So pharmacy is definitely a good field to go into. And again, the older we get, the more medications we use. Think of that baby boomer population out there. There's just a lot more Walgreens and CVS's out there that will need pharmacists on the retail side, but also the hospitals as well. As we think of this chronic care that's needed as people get older and being able to manage, I think what's called clinical pharmacists working in hospitals and doctors to try to make sure they're using medications in the right way with the chronic disease type patients.
What different departments are in each box?
All right, go ahead and tell.
Start. Cleaning and laundry.
Okay.
Maintenance and engineering.
Sterilization and disinfection. Materials management. Public relations.
Okay.
The educational department.
Okay.
This is human resources.
Okay.
Therapy.
That's information technology.
What is yours?
I did X-ray. Internal diseases. Pediatrics. Nursing.
Okay.
Food services. Medical records. Emergency room. Operating room. Laboratory and blood bank.
Admissions.
Okay.
And we even have the helicopter landing pad.
Is that wings or?
And wings, yes, and wings.
These